Welcome to Toledo Clinic TV. Our guest is Dr. Louis Tartaglia, a sleep medicine specialist. It's been a while since we've chatted, so what's new in sleep medicine?
There are a couple of new topics that have become a hot issue for sleep medicine specialists, not so much for the patients. Idiopathic hypersomnia, we finally have a drug that treats it, and there is a new way of being able to assess the patients so we can do research on other drugs. So that's an area of the field that's expanding really quickly. And then restless leg syndrome. Ropinirole and pramipexole are no longer first-line treatments, and so we've been trying to take the patients off those medications and get them onto some of the newer medications that are safer in the long run.
There are a host of sleep disorders, so how do you know when it's time to see someone like yourself, a sleep medicine specialist?
It's pretty easy. You're either too sleepy, you can't sleep enough, or you go bump in the night. In other words, you're moving during your sleep or just before you fall asleep. They're the three main areas that need to be looked at.
And at what point does it become severe enough, I think, is the question, because we all have sleep issues from time to time.
Right.
How do you know when it's serious?
When it's interfering with your ability to function during the day. For instance, patients with apnea will often be snoring for 15, 20 years. And then at a certain point they get to complain that they're not awake enough during the day, or they're waking up with headaches, or now they're snoring and they have high blood pressure, or snoring and have atrial fibrillation, or snoring and are waking up gasping. So it's time to get a sleep study, have somebody evaluate them.
It's probably important to point out that when you have disruptions in sleep, it's not just that you become tired. There are potentially some serious ramifications if you're not getting help.
Right. In fact, with apnea, we now know that the drop in oxygen and the sleep disruptions cause a reduction in gray matter and white matter. So it's actually damaging your brain.
Okay. What else do people need to know about when it's time to come and get evaluated?
Okay. So if the insomnia is causing sleepiness during the day, that's a bigger problem than just waking up in the middle of the night and being able to fall back to sleep. Even if you're waking up 2 or 3 times, you're in your 70s, that's pretty normal. But it's when it affects the ability to function during the day. When sleep apnea patients are starting to develop cardiac arrhythmias, it's critical to get the apnea treated.
Should you at some point in your life have a baseline test, or do you really just need to wait until you're having issues?
You wait until you're having issues. It's really easy. You just mention to your primary care physician, this is what's going on. If you mention that you're snoring, the primary care physician will look and see, well, is he sleepy during the day? Does he have high blood pressure? Does he have gastroesophageal reflux? Is he waking up with morning headaches, or does he have migraines that are getting worse? They're all indications that you need an actual sleep study.
Okay. And does every person who has sleep problems need to have an overnight sleep study, or can some of those things be just talked about in the office?
Most of them have to have an overnight sleep study. We have to look at what's actually going on while you're sleeping. Okay,
and what is that process like to have that study done?
Oh, it's pretty interesting. They wire your head up for an EEG, near your eyes for rapid eye movement sleep, under your nose for breathing, chin for snoring, EKG leads, a pulse ox, a belt to sense when your diaphragm's moving up and down, and leg leads. And then they ask you to follow the international protocol because it's a medical test, and you're supposed to lay flat on your back. And for some people that's a little bit difficult. And then we're able to, through the brain waves, know what stage sleep you're in and what's going on.
Okay, good information. Thank you so much for being with us.
You're welcome.